Howdy folks, it's Kevin again. It's just an update of how I'm doing since I got silicosis. Just to let you know a few things about how I'm progressing, if it's got any worse, what my heart beats like, how I've been doing with my diet and exercise, and just in general updating. I did about 5 videos or so, and I really promised myself I was going to keep on doing videos to, kind of hang with you and give you something to actually see on YouTube besides a bunch of videos with doom and gloom predictions. My videos are about somebody that has silicosis, that has a pretty, severe case of pulmonary fibrosis. It's going to have mesothelioma and is okay. I get some pretty aggressive heartbeats. I get erratic heartbeats when I eat certain things, when I exercise too much. So I can't exercise like I used to. The harder I try to exercise, the worse my heartbeat gets. Boom, 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 boom. I can't exercise like I used to. I can't go as hard as I used to. But since I started making my videos, I've kind of screwed up my diet. I've screwed up my exercise. Like the videos where I had this big beard. I was telling you, I was going to stay away from sugar and I was going to keep exercising. Well, I didn't, number one, really stay away from sugar. I've been struggling with changing my diet. And number two, I've been struggling at getting a really high level of exercise, getting a lot of walking, getting a lot of sweating, getting a lot of working out accomplished to really keep up with my health. So I've gone back on some of that. I haven't completely succeeded in changing my life in the last few months that I've had this. That's how my progress is going. That's what the update's really about. Is I'm not going to quit on that. I'm still trying to get to 130 pounds. I'm still trying to get to 150 and 130 to give my heart system and blood movement system a break so it can all run more smoothly and more quickly without a lot of salt water pressing down on it. And I was successful the first few months. I did lose a lot of weight, but it slowed down. Now that the cold season's here, now that Christmas is here and Thanksgiving and cold weather, I've actually been screwing up. I'm not exercising as much. I'm eating more, and I'm not exercising as much now that feasting season is here and the festive season. I've been eating more and working out less. So that's my update, and just to let you know that I'm not going to give up, and so you shouldn't give up. And my videos are there to let you see, things that I've said that, were wrong maybe, or I screwed up. To let you see a real person that's really suffering with silicosis. I get that erratic heartbeat. I get obstructive lungs where I can't work really hard without my heart really giving me a hard time. I have a sick stomach where this stuff's got in my stomach. I get headaches from it getting up my sinuses and into my head and into my sinuses area. I get headaches from that. And I got real silicosis. I got a real fibrosis issue where I could get cancer. from getting all this adhesive into my body. That's what I got. I got dust called crystalline silica, which is like an adhesive. It's like a glue, like a dry, dusty glue that when it sticks onto things, it really adheres to whatever it sticks onto. So it's an adhesive. What I got on my lungs, in my bowels, and what I got through my head, through my nose, sinus areas. It's like a fine adhesive. And this is like my 5th or 6th video. I think it's like my 6th. But it's an update on how I'm doing, how I've messed up some of my original resolutions that I said on video I was really going to try to work on. I was going to get smaller. I was going to eat smarter to really complement this problem. And as the festive seasons come up, I've kind of screwed up my resolutions. I haven't been perfectly dealing with this. So I've made some mistakes myself. And if you've made any of those mistakes or going back on resolutions or anything, I'm right there with you. I've been trying like crazy to get smaller, which at first, during the warm season, I did a good job. I lost like 60 pounds. But now it's slowing down. Now my weight loss has stopped. I'm like at 220. I started at 280. So it did pretty good, but then all of a sudden I stopped. Totally stopped losing weight. Been eating a lot of sugar, and the other day I just had like racks and racks of ribs, and like I'm a good old boy. I like to eat all the XXX adult foods, and it's hard for me to stay on a diet where I don't think it's the most robust diet. So I've been eating bisques and like all the most fattening stuff. So anyway, that's my confession of me going back on my resolution to diet well and exercise better. Because as the cold seasons come in, I messed up. But anyway, I'm still in that house and I'm working on it where I got silicosis. I went to a homeless shelter for a little while and left all the doors and windows open and it cleared the air out pretty good. My mom helped me get a filter for this forced air system. That is cleaning the air out fine, so the air is okay now. But I thought I'd just give y'all an update of how I'm doing, just in case there is anyone out there that just got silicosis or fibrosis, mesothelioma, any of those lung conditions, and your heart's really freaking out or whatever, and you're looking on the internet for anything like this, anything that's informative, someone that maybe had it before you, that can tell you what to expect or what to do. Now, if you get this really erratic heartbeat, this is the second part of my video. If you get this really erratic heartbeat and you don't know what to do about it, look up in your area or in a nearby city if you can find a free like psychiatric clinic where they might give you psychiatric medication to dull down your heartbeat a little bit. Go in and tell them, go to a free clinic and tell them that you have this a really aggressive heartbeat and you're there for psychiatric medication to get your heart rate to slow down. Tell them you have like a psychiatric issue with this medical problem. You just got this medical problem and it's giving you psychiatric issues. And what you do is you go contact your local psychiatric free clinic and you tell them that you're having like this really erratic heartbeat. It gives you no peace. It's really painful, and it's giving you these psychological. They'll ask you if you want to commit suicide. They'll ask you if you have any prior history with psychiatric problems. You just tell them no. But I do have this like aggressive heartbeat. You could tell your doctor, although they can often take a while to see you. Probably a better bet is to look up a free clinic where they mostly deal with psych problems, with psych issues, which is like, psychological, meaning the thoughts of the heart, the thoughts of the brain. And tell them that you're having like this really erratic heartbeat and you don't know what to do about it. You need some medication. Is there any way they can get you prescribed with something? Or, you really need to see a doctor. If you're having any kind of really erratic heartbeat, it's a bad thing. It's a bad sign to get a really erratic heartbeat that gives you no peace. Losing weight can help. Losing a lot of saltwater weight and getting down to like a very low weight. That can help a lot to diminish these aggressive heartbeats where you feel like you're going to have a heart attack or something. Then you probably need some almost like diabetic medication. The psychologists, the psychiatric wards helped me. They gave me this stuff called Invega, paliperidone. Well, I take a generic of Invega right now called paliperidone. And it totally wipes out the erratic heartbeat. It gives me a lot of peace. I can eat now without getting erratic heartbeat. I can rest now without getting erratic heartbeat. And I can do some work without getting a really erratic heartbeat. But Psych Med has really helped me. And that's just something I thought I ought to mention. That's an update on my previous videos. Is that I never really told you about my medication and, the recent medical progress. So I have been taking a medication, a psychiatric medication called paliperidone Invega. You can ask them there. Invega is really expensive, but if you can get some kind of insurance, or you get Medicaid, or you get Medicare, they might be able to get you generic, which is very cheap. But if you have a really bad heartbeat, I understand that, and that is really difficult. The erratic heartbeat is very scary, and it's very uncomfortable. It can make you feel like you just can't get any peace from your heart just, going crazy all the time. And I have that. And that psych medication really helped me out. Because I couldn't get a doctor to acknowledge that I even had silicosis. They said, well, we took an x-ray and we couldn't see anything. And it's probably because there's legal implications and they don't want to be implicated. They don't want to get involved in a lawsuit. So they don't want to say they see anything. Because you can sue somebody if you get this from their product. However, that's not really what this video is about. This video is about, I got medication and it helped. It slowed my heartbeat down. The psych medication really helped with my heartbeat. So if you're having this really bad heartbeat that doesn't give you any peace, try psych medication. Try psychiatric medication. And try going to a psychiatrist. Not just the doctor, because they might not be able to even diagnose you. They might not be really at liberty to give you a diagnosis, even though I suggest going to the doctor as well. Go to the medical doctor, but also consider psychiatric medication, because that can help to fix your heartbeat. If you have a really bad heart condition, try the psychologist. Tell the psychiatric people about it. And they might be able to get you a prescription for something that will help a lot. They helped me with my psychiatric medication, and I'm sure they can help you. So my phone's about to cut off my video, so I'm going to leave this video on my channel so if you can see it. It's like my 5th or 6th video. I really appreciate you watching it, and I hope that it helps you and it makes you feel better. And it's here for your reference anytime in the future if I touch on something that's of interest to you. So thank you for your time. And my name's Kevin. I appreciate it. And I'll try to make another video again soon. Okay, bye-bye.